Well, first up on the show, China was the first country which dealt with novel coronavirus with no clue of what the virus was or where it had come from. China had witnessed a sudden spike in the number of COVID-19 cases. China is now on its path to recovery. In this time of crisis, many doctors and health specialists rose to the occasion and worked day and night to take control of the situation. One such doctor is Sanjeev Choubey, who is a medical doctor at the St. Michel Hospital in Shanghai. He chose to stay in Wuhan and deal with the crisis. Dr. Choubey is now live with us from Shanghai Medical at the medical college there in Shanghai. Thanks very much indeed, Dr. Choubey, for talking to us this afternoon. This has been an extremely busy and difficult time for doctors and health specialists in China in particular. Can you share with us, firstly, the experiences of what it has been in China in the last couple of weeks? We've seen a massive spike and now, of course, a reduction of cases.
Okay, thank you. Can you hear me?
Yes.
Okay. Actually, now this is time for relaxing for us because the load is quite low as compared to the previous few weeks ago, around 4 weeks ago. The load was too much. It was around 80,000 patients all over the world, from in China itself, and in Wuhan, most of the patients are from there. But government has made the strategy to lock down the whole city, and they don't allow anyone to go out of the city and interact with or mingle with the people. Finally, they control this outbreak. Because this virus has 5 stages. In India, the stage 2 is going on. The third stage is going on the peak. The number will go more higher, as I expected, and other people, other doctors also expecting the same. The 4th and 5th phase is resolving. The China is already in the 5th phase of that, so the workload is now less. Today we have only 22 total new cases all over the China, and in Shanghai we have received only 6 or 7 new cases. And recovery rate is quite good.
Right.
So all things are going good.
Right, absolutely. Now. But also there are some reports now coming in, Dr. Choubey, of the fact that certain patients who were, under quarantine, who became okay, are now seeing a second wave of testing positive. The same people who tested positive earlier recovered and now again are testing positive. Is this some sort of a mutation of the virus? What are the indications coming in medically on this?
See, some of the cases was actually, it's not the true news. Actually, this cases was not detected. Some people says that it's a relapse of the case, but the fact is that it was not quarantined or it was not detected. They are in the window period of that virus attack. And recently we just find out that they are also positive for this test, and then here we made it quarantine. And we just isolate them. Even Indians also here, there are around 8,000 Indians are staying here. And those who are coming from the different part of the world, even mostly from the India, they are having isolation for the 14 days. So it's not the true news that it's going and having relapse. But definitely some of the relapse happened. That is in the old stage patient, the people who are old, not in the younger one.
Okay. And are these, we, as non-medical people, we hear all kinds of information coming out, on the internet. Is it true that if you get COVID-19, that your lung capacity in the future will be reduced by about 30% going forward for the rest of your life? Or is there a chance of full recovery once the disease has come out of your system?
See, first of all, you need to understand the virus. There are more than 200 plus, around 300 viruses are existing in this world for the thousands of years. Time to time, like SARS, swine flu, bird flu, Zika virus, Ebola virus, these all are the same family group, some of the different family group, but every virus has its own cycle. Okay. Now, if I consider your point that this capacity. Please repeat the question, please. What was the question? I forgot.
No, that the lung capacity of a human being who's got COVID-19 will reduce by 30% going forward.
Okay. I have effect upon us.
Right.
So people who are healthy, fit, immunity is strong, even the virus attack them and pass away, and then some of them people don't have even symptoms. The people who are having a comorbid condition like a high blood pressure, coronary heart disease, diabetes, asthma, respiratory syndrome, they are having a definitely they have to compromise with their health, and it reduces the life expectancy of them.
Right.
So definitely it's affecting us. Yes.
Right, absolutely. Dr. Choubey, also let me ask you now that, China is almost in the recovery phase, and we're seeing a spike of cases in Italy and in other places in Europe, a sudden surge of deaths. What are some of the experiences that you have seen that the European nations and possibly even India going forward should take into account as far as the disease is concerned?
See, it's all about I can say it's all about the discipline. Here in China, they take it as very seriously because it's a matter of their health. But in other country, I don't know how the government is handling the case. But here, it's very organized way, and the government, nobody was panic over here. Just they follow the government instruction. They use mask, hand washing, and the simple thing which is all over already the TV channels and WhatsApp and WeChat and all media is saying the same thing. That hygiene is very important, and they are doing the same thing, and they not get affected. But the outbreak is happening in Spain, Italy, especially around 24,000, and already there is 1,809 deaths already declared. It's all because of the spread migration, and for there are several factors are involved. The biggest hub for this infection to spread is the airport. The central central AC system, ventilation system, yes, which actually people exhale and inhale when inspired, and that was taken by, because it's a aerosol, it's a droplets, which is actually it's a small droplet, so it's suspended in the air for around 10 to 20 minutes.
Right.
If someone who pass, it can catch.
Okay, so
this is the.
Right, and so from your medical understanding, which phase do you believe India is in at the moment, and what sort of precautions should we be taking, given the fact that we've seen not too many cases here, thankfully, but going forward we don't know?
See, in India right now, it's in the stage 2, and I'm expecting the stage 3 will be more. It will be in the high peak. It's more cases you're going to see in the future. I am expecting around 1,000 people by the end of this March, because some of the casualties also happen. Some people escape out from the isolation. So, and this is going to be spread, because the third phase is a very crucial phase where people need to be disciplined. This government cannot do anything unless and until people have to understand. So it's going to be increased. Definitely it's going to be. Right now it's only 115 cases declared.
Right, Dr. Choubey there indicating to us that India is in the third phase, is going to be hitting the third phase, which is the peak phase, and we should be worried. And containment is one of the solutions to that, and the government can't discipline us. We need to show our own discipline as well. Report if we have symptoms. Self-quarantine as well is very important at this point. And as the doctor was indicating, that airports are a major hub for the disease, as are the common ventilation systems which you see in most offices around the world, which become carriers of the disease. And China, of course, is in the 5th stage of recovery now, but it's peaking elsewhere now in Europe, with Italy having the maximum deaths outside of China, and there needs to be a more rigorous system of containment, whether it comes to Europe as well as India. So that indication there coming from Dr. Choubey, who was in Wuhan all of this time fighting the disease.